my name is Toni, and this is my patient Mallory. I'll be doing a focused assessment on her hair, head, skin, neck, nails, and lymph nodes. First, I'll be starting off with the assessment of Mallory's hair. Mallory's hair is normally brunette, and she has dark brown hair on her eyebrows and the rest of her body. She has blonde hair with hints of purple at the top. No signs of lesions or flaking, dandruff, or alopecia. Next, I'll be assessing her head. I'm just gonna feel around to see if there's any lumps or masses or any tenderness. Are you currently having a headache?
No.
Nope. Does it hurt anywhere?
No, there's no tenderness.
Okay. Next, we'll be moving on to the skin assessment. So I'll be assessing Mallory's face, which looks symmetrical. She has a nose ring right here. Her skin is olive, and it looks that way on both arms and legs. She has multiple nevi noted on her neck and her face that are dark brown and round. It's also flat. Throughout my assessment, I found multiple bruising on Mallory. One noted on her left lower leg, which is right here. It is purple. Is it tender?
No.
No. Okay. Skin's blanchable. Next, I wanted to point out a skin lesion that she has on her back. So I'll have her turn over so you guys can get a better look of that. Okay. Mallory has a skin lesion here on her back. There's also a tattoo noted. I'll be assessing this lesion with the ABCDE. So the lesion is asymmetrical, and you can see that the borders are irregular. It is dark brown in color, and if you measure it, it is 1/2 centimeter in diameter for length and width. Have you noticed this mole before?
Yeah, I've noticed it.
Okay. Has it changed in the past couple of months?
No.
Okay. Next, I'll be assessing Mallory's neck. So her trachea here is midline. Do you have any neck pain or tenderness?
No.
Can you turn your head this way and turn it this way? Bend your head forward and bend your head backward. Okay, and you can go back to normal. So she has full range of motion. I'm just gonna check right behind here and try to palpate her thyroid. And can you swallow? Okay. And you said no pain or tenderness?
Yep, none.
Okay. So next I'll be palpating Mallory's lymph nodes. I'll also be assessing her temporal and carotid arteries for bruise. And she said earlier that she did not have any headaches. I'm just gonna palpate for her temporal artery and take a listen. I'm going to compare it with the other side. No bruise found. Next, I'll listen for her carotid. No bruise found there. Next, I'll be palpating for her lymph nodes. So right in front of the ear are the preauricle lymph nodes, and behind her ears are posterior. I don't palpate anything, which is a normal finding. Now I'm palpating for her tonsillar lymph nodes. Again, I can't feel anything. And then her submandible, which is right underneath the chin. And when you're palpating, you want to make sure you do it in a circular motion. Her submental lymph node is right here, which you want to palpate with one hand. You want to make sure you're using the finger pads to palpate. So the last assessment I'll be doing on Mallory is an assessment of her nails. So if you take a closer look at her hands, they are cold, but there is cyanosis to the fingertips. You can see that her nails are pink and round. And she has capillary refills less than 3 seconds. Can I have you put your thumbs together like this and raise it up? Okay, so there's a little space right in between that kind of looks like a diamond. This technique is called the shamrock technique. So it's looking to see if she has clubbing in her fingernails, which if you look at them closely, she does not. So that's it on the assessment for hair, head, skin, and nails, and also an assessment on Mallory's lymph nodes.